Opioid addiction is a problem crippling parts of the country, including our area. In Bel Air, the epidemic spared no exception. Overdose numbers have been on the rise. WMAR 2 News' Skylar Henry learned, though, there is a program this morning in Bel Air where leaders say it is reducing the trend, and they think that larger areas can follow suit as well.
In Bel Air, the shroud of heroin and opioid addiction is rattling the town's police department. The force inundated with calls of overdoses and, even worse, deaths. For the last 4 years, Police Chief Charles Moore has watched as the number of those impacted have slowly crept up into the city of a little more than 10,000 people.
We started to really look into the dynamics of how this happened and what we could do to try to resolve and try to fix the problem.
Initially, Moore says first responders would treat the case with a proverbial Band-Aid, helping those that have OD'd with life-saving Narcan or by putting a person in jail. But the problems worsened until he got an idea from his peers in Western Maryland, creating a drug abatement response team, or DART.
We were in a spiraling downward epidemic of opioid overdoses. And the overdoses only show a small fraction of the actual addiction problem.
Detective Matthew Gullion was on board from the beginning. The program would be a partnership, a holistic approach to tackling addiction in Bel Air by the police department, the Harford County Office of Drug Control Policy, and the nonprofit Family and Children's Services.
The important aspect is getting the behavioral health assistance, the wellness, to the people who need it most. And what we're finding is those are the people that are currently addicted to not just opioids, but alcoholism, other pills, and other substances as well.
And it starts here, helping those suffering develop a recovery solution plan. The plan would allow for peer recovery specialists to walk with overdose survivors through the long road of getting better.
Sure, we can get someone clean, we being the community, but they're not going to be able to sustain that unless you kind of get to the root cause of what led them to want to numb out and not experience their feelings in the first place.
Jennifer Redding helps oversee the Behavioral Health Services Department with the nonprofit. In the year DART has been implemented, 8 people who previously overdosed have been referred to the program. None of them overdosed again.
We're able to provide not only therapy and behavioral health services, we can also provide case management. So oftentimes, someone, if they're overdosing or they, are experiencing some sort of impact by drugs or alcohol, they're not ready necessarily to come in and talk to a therapist right out the gate. And so that's the beauty of case management.
It's why leaders in Bel Air say DART is working. Despite an increase in overdose deaths in the city in 2018, the amount of people ODing has decreased by nearly 40%. Chief Moore calls it a statistical success.
That was enough for me to say, hey, we're having a positive impact.
And while it's a small sample size, police think the program could be big for other jurisdictions in the battle against opioid addiction.
We can solve this problem through behavioral health. We can't arrest our way out of this.
In Bel Air, I'm Skylar Henry, WMAR 2 News.